there's this client that came back. Initially saw her almost a year ago, had a lot of issues with addiction,
Mhm.
smoking, alcohol. She took meth and heroin about 10 years ago.
Okay.
6 months ago with coke. So she's trying to work on her addiction to smoking and alcohol presently. Any oils that would help augment that um, protocol?
Okay, just because of the coke, like I don't know if you guys have had this discussion. Has there been any sex addiction kind of things or
Her, well, yeah, I think so.
yeah. Um I would use things that are very supportive of um like brain chemistry and like mood. African bluegrass would be helpful. I mean, straight up for addiction stuff, like things that are supportive to the nerves, like nervines, like so Melissa, basil, um, um, there's that nervine blend. You could even probably throw in lemongrass in that realm.
Okay.
Possibly even sage. Actually, now that I'm talking that out, sage might be a good go-to one.
Just the normal sage?
Just normal
I mean, the
sage
regular.
or Dalmatian sage, like something like that.
Okay.
Um, I mean, I probably would like it if she used a little bit of like Melissa or basil, like internally, just because of the nervine effect and things like that. It's just anytime you have like addiction, the more you calm and soothe the nerves. And
Got it.
so sage is calming to the nerves. Those two things are calming to the nerves.
Mhm.
And then the African bluegrass, I would actually either have her put it on as a body tonic or a salt bath, like kind of regular as a salt bath, because there's things that happen in the skin that have to do with brain chemistry and like moods and things like that that it sounds weird, but it's still like a kind of toxicity that can happen. And then it affects how the organs function. It affects how the lymphatic system, how the nervous system kind of responds. And so like the more you clean up the skin, even with your healing, going through and just like really thoroughly sweeping like all the skin,
Oh, okay.
they'll all of a sudden they'll feel like a bit lighter. Like you can see like there is a shift in their chemistry. They function a little different. And when you're looking at things like meth, PCP, LSD, there's a certain amount of exposures where it starts to like change the physiology of the brain. And as much as you try to work on the brain, it helps a bit. But the big thing is, it might change the brain, but then the brain starts changing the physiology because, it's giving all the orders to the body.
Mhm.
And just going to the brain, it's like you're having to try to overcome all the things that have happened. So you almost like walk it backwards. So you start at the skin, you do a lot of blood purification, with the organs and the lungs and all that. And then eventually you're going to make your way back up to the brain. But I'd almost like walk it backwards. And so I usually start with the skin.
Mhm.
Um, how hard did she use the cocaine? I'm just curious. Like just for a little while, or was it like a year, 2 years, 5 years?
Years.
Years.
Yeah.
Yeah, there's probably a dopamine issue in the brain.
Is
Um,
that why she's feeling so disconnected to
yeah,
herself?
yeah, yeah, yeah.
Okay.
Yeah. And the reason why I asked about the sex thing is back in the day when I was specializing in addiction, usually specifically when people were using cocaine and going off of it, we would have them be celibate for like 6 months to a year because what cocaine hits in the brain is very similar to sex. And so, you kind of go off the coke, but the sex part keeps hitting that part of the brain and doesn't let the brain shift and change. And so,
Oh,
I'm not telling you that she needs to do that, but there's a dopamine issue. And so there is an herb that works that, but I'd almost like to see how she responds to some initial treatment
mhm.
and really support the nervous system, like just calming, soothing to the nervous system. Even the use of sage is very calming to the sensory nerves and balance out the autonomic part of the nervous system with like lemongrass. Lemongrass is your best bet, but still you could use like anise or tarragon, marjoram, something of that nature.
Mhm.
That would be super helpful. I mean, even the stuff that we're going to cover on the weekend for the trauma release could be helpful, just because there's usually a lot of painful feelings involved with addiction. I mean, that's the thing, is the addiction is just a reflection of something else going on. There's usually a lot of pain underneath, like a lot of pain, a lot of trauma, a lot of hurt feelings. And so
Yeah.
you almost want to kind of keep going back and forth with treating the physical condition, but soothing the trauma and the hurt feelings when you're going through and working with somebody like that. Yeah.
Someone that she's related to seeing me too, and I just learned the history of abuse
Yeah. It's
since
usually,
childhood.
yeah,
Yeah.
something usually has happened when, you know, yeah.
So deal with the addiction first and then the
I
trauma.
would go back and forth, honestly. Like I would
Okay.
go back even in the same session. Like you could be in the middle of doing some physical work and then stop and do a little psychotherapy. So
Got it.
when we talk about abuse, are we talking physical or sexual or verbal?
Verbal for sure. Maybe some physical in a violent way, not sexual.
Okay, so really clean up the basic chakra and really look at the protective web of the basic chakra. In that case, too, I'd also look at the kidneys quite substantially.
Okay. For the
Yeah,
protective webs or
yeah,
okay.
yeah, yeah.